We're here at MemorialCare Miller Children's and Women's Hospital in Long Beach to talk to the access and transport team, because we often forget how important the transportation is in terms of really taking care of patients from one building to another. I'm here with the access and transport team at MemorialCare Miller Children's and Women's Hospital. Shauna, how are you doing today?
Good, thank you guys for coming.
I'm also here with Dr. Fati and Dr. Antonio. How are you both doing?
We're doing great, thank you.
Doing very well.
Well, thank you for having us here, first of all. We always forget about the importance of transportation. So tell us, Shauna, what does that look like here at Memorial in Long Beach?
When an outside hospital decides they want to transfer a patient for a higher level of care, a neonate or a pediatric patient, they call our access center, and that gets them in touch with our transport team and our transport physician. We accept the patient, and we send out an ambulance, helicopter, or fixed wing to the outside hospital to bring them here.
Dr. Fati, you deal with pediatric patients. So tell us, what does the process look like from taking children from one building to another?
So we pride ourselves in having highly motivated and skilled transport team, which are our transport nurses, respiratory therapists, and physicians, where we actually provide the excellent care that we provide here at Miller Children's and Women's Hospital in Long Beach to the outside hospital when the call comes in. We bring patients safely and quickly after we stabilize them at outside hospital to our institution where a higher level of care can be provided.
Dr. Antonio, you deal with neonatal patients. Tell us, how does MemorialCare here really set itself apart in terms of really transporting patients safely?
Yeah, we have the unique opportunity to offer what's called telemedicine and telehealth, and that really gives us an edge over many of the other institutions where we can be present in the delivery room through telemedicine technology, which is audio and visual, where we can watch a baby being born, so that when we prepare for transport and bringing a baby here for a higher level of care, we have all the information and we can watch the baby's situation unfold right before our eyes.
How does the transportation aspect of it set itself apart as well? Why would patients need to be transported from one hospital to another?
A lot of the hospitals within our community and the state focus on adult patients. Obviously, every patient goes to the emergency room, and some of the emergency rooms do not really specialize in really sick neonatal or pediatric patients. So when calls come in, the best place for those patients are really at children's hospitals and places where they focus on giving the best care with the latest available literature to neonates and pediatric patients.
We're here to serve the community before and after the transport, as well as during the transport. So a critical part of the work that we do here is to, after a critical transport, to go back and give the community feedback, especially the lower volume ERs or nurseries that have no or little experience with those difficult patients, so that they can be better prepared for the next time. That way we continue to strengthen our entire network of hospitals and systems.
Okay, so finally, we do want to know, as we got to ride along here in the ambulance, Shauna, tell us, who really sits in the ambulance and how do you treat a patient?
Sure. So I'm so proud of our team. With these respiratory therapists and nursing nurses just provide excellent care. They go through special training, they go through safety training and emergency medicine training. And so riding in the back of the ambulance, I think it's so important with pediatrics because they have to keep them feeling safe. And so we use things like DVD players and toys, and iPads, of course, speaks every child's language. And keeping the parent is another factor to keep them calm. So they're looking at a lot of things, not just the health of the patient, but all the other dynamics that are going on in a moving ambulance.
As you've heard from Shauna, Dr. Fati and Dr. Antonio, the well-being and safety of patients is number one here at MemorialCare Miller Children's and Women's Hospital in Long Beach. Now, for further information, you can head on over to millerchildrens.org/transport. I'm Yasmin Tanras with Long Beach Local News.